Robotic thyroidectomy. Hello. This is an educational video designed to improve your understanding and overall experience for your robotic surgical treatment of thyroid cancer. Please pay attention to the following materials for your safety and optimal treatment results. Background and indication for surgery. Thyroid gland is a butterfly-shaped hormonal organ located at the front of your lower neck, which is divided into left and right lobe, isthmus and pyramidal lobe, and the gland secretes thyroid hormones which regulate many metabolic functions in your body. In contrast to conventional open thyroid surgeries or endoscopic thyroid operations, robotic thyroidectomy utilizes the specialized robotic surgery system called Da Vinci. Da Vinci robotic system allows for a remote control of robotic arms where a surgeon operates from a nearby console. Advantages of robotic arms include wrist-like articulation of instruments that allows for an ideal range of motion similar to that of human wrist and hand. Furthermore, the camera also offers three-dimensional view of the anatomy while providing up to 15-fold optical magnification, which confer improved overall visualization and maneuverability. Furthermore, unlike the conventional open neck surgeries which often result in conspicuous neck scars, robotic surgeries provide much greater cosmetic satisfaction. For these reasons, indications for robotic thyroidectomies are expanding to include various differentiated thyroid cancer, as well as large benign thyroid nodules and Graves' disease. Similarly, robotic surgeries are being widely utilized in various cancer treatments including prostate cancer, colon cancer, uterine cancer, and lung cancer cases for its advantages in maneuverability and visualization. Surgical procedures. Once the patient is anesthetized and the operative field is prepped and draped in a sterile fashion, 4 small incisions are made at the left and right armpit skin folds and areolar margins. Through these incisions, tissue tunnels are created for camera and instrument insertion. The surgeon examines the operating field via the 3D view, and using the robotic energy devices, thyroid gland is carefully dissected off the surrounding tissue while achieving good bleeding control. Depending on the tumor size, location, and number, a partial or total thyroidectomy may be performed. And if there is an indication, lymph node dissection is also performed. Once the thyroid is removed and all bleeding is appropriately controlled, the wound is closed with a temporary drain in place to monitor and minimize any fluid accumulation underneath the skin. Subsequently, the skin incision is closed with a suture. Postoperative care. To avoid breathing complications after the surgery, patients are encouraged to perform deep breathing and coughing exercises. As the anesthesia wears off, patients may experience pain along the surgery site, sore throat and neck stiffness secondary to the breathing tube placement and neck positioning. However, these symptoms are often well tolerated with pain medications and often resolve in few days. If a drain was placed, it is routinely removed prior to discharge once the output had decreased and the drainage has cleared. Please be careful not to accidentally dislodge the drain or kink the tubing while sleeping or moving. Complications of surgery. Bleeding. Your neck has abundant blood supplies with extensive blood vessels. And despite a meticulous effort for a good bleeding control during the operation, it is possible to have a delayed bleeding complications. Bleeding in the neck can pose a serious breathing problem, if it forms a hard and tense buildup of blood which can lead to swelling and obstruction of the airway. Immediate intervention is required to evacuate the blood and to control the source of bleeding. Wound complication. Creating a skin flap on your upper chest and neck may form a bruise, which usually resolve in few weeks. Postoperative pain is generally well tolerated with pain medications. Few percentage of patients experience altered skin sensation over the chest and neck area, which usually resolves in few weeks to several months in rare cases. These side effects relating to skin changes are easily accessible, and they are often self-resolved over time without any specific treatments. In addition, in rare cases, skin adhesions along the skin flap area may cause abnormal wrinkling and pulling. This problem can be usually prevented by performing a postoperative neck exercises as shown. Nerve injury. Your left and right recurrent laryngeal nerves, which innervate vocal cords for phonation, traverse adjacent to the trachea right under the thyroid gland. Although preservation of recurrent laryngeal nerve is the key principle in thyroid surgery, some patients experience nerve injuries which often resolve in few weeks to months. Rarely, a permanent injury may occur. In an advanced cancer operations, the nerve is sacrificed if involved with cancer. Some patients may not experience much symptoms, but certain patients may complain about voice change and breathing difficulties. Surrounding tissue injury. Since the thyroid gland is surrounded by major vessels as well as digestive and airway structures, these organs can be injured during the operation. Hypothyroidism. Thyroid hormones stimulate metabolism in your body and thus, elevated thyroid hormone level causes symptoms of hyperthyroidism, while diminished level causes symptoms of hypothyroidism. Once the entire thyroid gland is removed, no thyroid hormones are produced in your body, and therefore thyroid hormone replacement therapy is required to prevent hypothyroidism, and also to suppress thyroid cancer recurrence. Hypoparathyroidism. There are 4 parathyroid glands that regulate your calcium level in your blood, located on the back surface of the thyroid gland. During the thyroid operation, these glands can be injured, which may lead to transient or, in rare cases, permanent dysfunction of parathyroid gland, leading to low parathyroid hormone production and subsequent low calcium level. Lowered calcium level can lead to numbness and tingling of your hands and around your mouth, as well as muscle spasms in more severe cases. These symptoms are treated with calcium and vitamin D supplements until the parathyroid gland recovers. Possibility of cancer. Fine needle aspiration biopsy is the gold standard for diagnosing thyroid cancer prior to operation. However, the fine needle aspiration biopsy is not always accurate. A pathology evaluation from a resected thyroid tissue will provide an ultimate diagnosis, and depending on the result, one may require an additional surgical or medical treatment. This concludes the robotic thyroidectomy educational video. Thank you.